All right. Exactly what we saw before with the sympathetic nervous system activation is basically primarily as a result of the baroreceptor reflex stimulation that detect any change in the pulse or the pressure. Remember that those baroreceptors are located in the carotids and the aortic arch. Uh, Obviously, when they activate, send that message to the central nervous system that would increase the activity in the sympathetic nerves, and especially directly to the heart, and also resulting in venoconstriction. At the same time, you see over there that how the famous juxtaglomerular cells release renin and activating the RAS system, renin, angiotensinogen cascade with aldosterone, resulting in increased sodium and water retention and the remodeling of the myocyte, loss and hypertrophy of the remaining cell by interstitial fibrosis. That is what happens with the long-term situation in this patient. Meaning this is particularly important, but it's very related to what we saw already in the previous chapter. I put it over there just to repeat and to reinforce the message about the importance of the sympathetic nervous system and how this one works over there. Meaning that you see a couple of times, probably something will stick over there, will make your life a little bit more easier from that perspective. Let's move on over here. In the heart failure, remember that we have an increase in the preload initially as a consequence of the reduce of the ejection fraction, with resulting increase in the residual in the basically volume and the stage volume inside of the ventricles. The decrease of the cardiac output to the kidneys obviously will be reduced because the heart is not sending a lot of blood out. Reduced obviously in the glomerular filtration that will also create conservation. And this is why you have the famous RAS cascade activation that try to elevate the blood pressure back to normal by retaining fluid over there. There is an interesting law that is called the Frank-Starling mechanisms of the heart. And basically what it's trying to tell you over there that that law means that the heart will pump the same amounts of blood that he received, meaning that he tried to compensate for any different volume and he will basically expel the same amount that he received. That is basically the Frank-Starling mechanism of the heart. Obviously, this will create damage in the heart failure, will make this one more pronounced because a heart that cannot move huge amounts of volume will continue with this cycle of deterioration continuously over there. In the clinical manifestation, remember, left ventricular failure is the most common one. This one is basically, we are reaching chapter 19, yes, almost the 20. Clinical manifestations over there. Ventricular failure is most common, often lead to the right ventricular failure. And you have over there what happens with that insufficiency over here. The pumping manifests by the poor cardiac output, maybe manifest by confusion, fatigue, tachycardia, reduced urine output, and poor peripheral circulation. That is basically something that you see over there as a backward failure, congesting of blood behind of the pump chamber over there. That is also something we'll see soon, okay? Meaning important because this is part of the test. There is a question related to that. Now, if there is something that I asked you before, was exactly basically related to the left side heart failure. Some of you received the question from the right side failure that I also have it over there. I will go with the same particular questions again because this is important. Everybody needs to reinforce the knowledge about how that patient had this particular situation, had this particular problem in heart failure. Meaning, if you have a left side failure, you have it over there. Everything that you need to know, everything that is there to answer that question in the test, because we'll go with that again. Some people will get the left side, some people will get the right side. Two different questions with the same kind of meaning to tell me what's going on with that patient, what will happen. And some will receive the hybrid question, because I will try to mix some of the things of the right side with the left side. Careful, okay? But that information is there. I'm asking those questions again. The ventricular fibrillation was an answer to one particular question. You already know that. Yeah, I need to go with that again. Even I think in one of the PowerPoints question, I put something similar. It's interesting that I have a lot of people that don't even look to that question in the PowerPoints. I had that question wrong. I had some person that basically didn't review that particular question, even that I mentioned that I will put it. Meaning, careful with this one again. I will go with this particular question again in this particular test. It's essential that everybody understand what ventricular fibrillation means for that well-being of the patient. Okay. Moving on over here. Then we have the famous blocks. In the previous quiz or previous test, I asked you for the general block. Basically, with number one is what you need to see. This basically over here was the answer to that question. And many people became a little bit confused about that. In this particular one, I am making a favor to you. I will ask you in one test, because not all of you will have the same test, will have this particular question. And in the other test, you have the third degree or complete heart block over there question. Meaning two questions about heart block. One group of will have the first degree and another group will have the third degree. Careful. You don't know which one you will get. What is my advice? Try to learn both of them. And that way you will avoid any kind of confusion over there. It's clear? Moving on over here. The causes over here, the famous shock that you already have a little bit already know because we asked you for these ones. This time, I will go with something different. This particular PowerPoint, I put it over there because it's basically like an introduction and a summary of all the shock that you have. Meaning, you saw this one in the quiz last time. Now, I will go not only with that one again, but I will go with this one and this one. Meaning there is three different questions for shock that you need to understand in your test in case that you get one of those tests. If you are the lucky one, we'll go with the cardiogenic shock again. Good for you. But careful with the obstructing and hypovolemic because I will ask them. The cardiogenic shock, you already saw it over there. Usually the result of severe ventricular dysfunction associated with myocardial infarction. You have the diagnostic features over there. I will not ask you diagnostic feature, but that first bullet over there need to be understood by you. The cardiogenic shock, this one is important, the low cardiac output. Obviously, you have a lack of oxygen delivery to the tissues, higher oxygen extraction, and over there, low basically volume of oxygen, peripheral oxygen. And therapy over here is to improve the cardiac output, myocardial oxygen delivery, and decreasing the workload. But I will not go with this because it's more treatment. What I want right now is that you can tell me what happens in the cardiogenic shock. What is the result of that cardiogenic shock in that patient? In the hypovolemic shock, this is the other question that you will see in some of the tests. Result for inadequate circulations of blood. Could be by hemorrhage, could be by burns, leakage of fluid into the interstitial spaces. External hemorrhage is the most common cause, obviously, meaning careful with that first bullet over there. I think that as soon as you see external hemorrhage, we are talking about volume, and that will give you the hint what could be the answer to that question. But still, careful over there with that first bullet over there. In the hypovolemic shock, we have some particular classes. I like to ask you sometimes some of the classes probably could be a true or false question in one of the tests. I didn't make many, but because there is a question in the test, yeah, I don't know which one is the one that you will choose. That's why I put these PowerPoints over there and making aware there is a question regarding those 4 classes of hypovolemic shock. Careful. Now, there is a question about MODS. Not everybody will get it. Multiple organ dysfunction syndrome. When 2 or more systems are affected, and the most common cause of the secondary MODS, you got it. The sepsis and the septic shock. That's why it's there. Meaning, careful with this one. I will ask you for this one. There is a multiple choice in some of you in regarding exactly what is the causes for this MODS over there or the dysfunction syndrome over there. That is what I will attack in this area over here and with the next bullet also. Now we jump to the next chapter. You see that we are reaching the last chapters over there and the respiratory problems, and we have asthma. In asthma, I put these PowerPoints over there to give you basically an introduction because it's the most common chronic disease in children. I will not ask you this one, but it's something that you need to make reference to this one later on. But this PowerPoint, just as an introduction, I don't tend to ask them this one over there just because it's the most common disease in children. Now, what I will ask you is careful with what that means, extrinsic asthma. And remember exactly what you suspected. The IgE is the immediate response is common, and you have a treatment over there that even that I don't ask you the treatment, you need to understand there is allergen-specific immunotherapy and environmental control. Careful with this one. There is a question regarding to that in the test. In the theology, yeah, here we jump to acute bronchitis. Believe it or not, I basically choosing what I will ask in the test. In the acute bronchitis, I have some things over here. First of all, what create this problem? And then you have the asthmatic bronchitis that is a little bit different. Also, you need to understand this one for your test to avoid confusion. Now, this particular PowerPoint is a question for one group of tests. The pathogenesis, I decided to remove it this time. I will not go with pathogenesis. It's the only thing that I am removing right now, effectively now, because I include chronic bronchitis, and this is a question in the test. It's important to know chronic bronchitis and make sure that you understand everything that is there. I have a question for some of you asking from acute bronchitis and another group of questions just asking for chronic bronchitis. Meaning, don't tell me that it's a type B, COPD, blue blooded when you have an acute bronchitis in front of you. This is only happens in chronic bronchitis. Careful. This is only the hint that I would tell you because it's there. The questions I made it is there. Don't confuse this one with acute bronchitis, and that is the reason that I put acute bronchitis before. The emphysema is another question. Yeah, I will give you a hint. The question will be related to those particular 2 bullets over there. Meaning, as soon as you see those 2 bullets over there, you already know that I am talking about emphysema. This is important because it's something that you will see in some smoker sometimes and other person with some respiratory problem. But that is a question. No matter what is there, I need to ask you for emphysema and it's there. Another disease that I will ask you, I told you that in the class, is cystic fibrosis. I will ask you for that. Remember, that is the most common genetic lung disease in the US. Important to remind you that because I will ask you, is there? The question is there, is a multiple choice. Meaning, this part over here, extremely to answer that question. Be careful with this one because looks similar to the other conditions of the lungs, but this one in particular have a characteristic, and it's the dysfunctions of those genes over there. Clear? The clinical manifestations, I will not go a lot, just with basically because they are very similar on them over there. I just leave it over there as additional information, but I will not ask you for this one. I know that many people will become confused with this because normally all of these particular problems on the airways have the same kind of clinical manifestation. But remember, when I make a specific for that particular screening of genes, I am talking about cystic fibrosis. Another disease that I put over here, and it's just to avoid confusion, is sarcoidosis. Sarcoidosis is acute or chronic systemic disease of unknown cause. That's the first thing that you need to remember for this one. If someone have a question on this one, because what it is over there is basically a multiple choice that we try to mix this one with the previous cystic fibrosis. Meaning, if I put acute or chronic systemic disease of unknown cause, it's impossible that is cystic fibrosis. Careful with this one in that particular bullet. We also have hypersensitivity pneumonitis. This one have also a genetic predisposition, and the reason that I put it is because there is a case in the test that is very similar to this type 3 hypersensitivity reaction that I told you that I will ask in the test, meaning that one can help you to answer the other one. Careful with this particular one, okay? I didn't mention that this is the answer to the question. I'm telling you is that the case in the way how behave is to the type 3 that is a question in the test. Okay, careful. Moving on over there. Another thing that I need to ask you is the acute respiratory distress syndrome. You have over here the damage to the alveolar capillaries over there. Yes, 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 that is correct one. Damage to the alveolar capillary membrane causes widespread protein-rich alveolar infiltrate and severe dyspnea and happens in associated with the pathological processes. Careful with that one. I need to ask you about acute respiratory distress syndrome and not only affect the adults, also affect the children. We will see a little bit of that soon. By the way, there is a question about acute respiratory distress. Acute respiratory distress increase the permeability of the pulmonary vasculature, lead to the development of protein-rich pulmonary edema, and it's here that I will try to make your eyes to look because it's something that I would like to ask you. Yeah, I will be more specific. The question is related to this particular two over here. Okay? That is important to make the rule out in the question in this particular test. Careful with those two bullets because that's what will tell you what will be the answer. Moving on over here. You have the pathogenesis. The only thing that I will ask you in the pathogenesis that could be in the question is this fellows over here. The injury in the alveoli, the injury to the pulmonary circulation, and the atelectasis and the decrease on lung compliance from the lack of the surfactant. That's it, the only things that I will ask from there when I am building the question in your test. Careful with that, okay? You need to think, you need to reason. Careful with that particular question. That is correct. That is chapter 23. Again, this is one of the other problems that we can encounter. Infant respiratory distress syndrome, also called hyaline membrane disease, similar to the adult, but normally you will see this one in premature neonates, obviously, because they lack of the surfactant that we already mentioned before. Remember, the lack of surfactant because those lungs are completely immature. The neonate must generate high intrathoracic pressure to maintain that alveoli open, basically. And that's why this can increase alveolar surface tensions and decrease in lung compliance. Careful with this particular one because it's very common, obviously, because we have a bunch of premature babies sometimes in the guards. Now, jumping now to some pleural effusions, we have 5 types of them: transudate, exudate. Transudate, the first two over here, transudate, the first two over here, low in protein, that is the transudate, associated with severe heart failure of edematosus states. Very interesting. Now, in the test, somebody else will get this question regarding the exudate. And this one, when you see a lot of protein over there in that exudate over there, in that pleural effusion, it's because you have malignancy, pulmonary embolism, sarcoidosis that I mentioned before, even post-myocardial infarction syndrome, pancreatic disease also. Meaning careful with these two because some people will get one of these two questions in the test. Also, the others that we will see, but I will not ask, and I will just basically make reference to this one only to avoid confusion with the other two. Empyema caused by infections of the pleural space, high protein exudative effusion, the hemothorax, presence of blood in the pleural space, and resulting chest trauma. Basically, when you have a trauma in your chest, contain blood and pleural fluid that is hemorrhagic. That's why I like to put it to avoid any confusion with the other two. This is the only one that you need to pay attention right now. And the final over there, chylothorax or the lymphatic exudative process that develop from trauma over there. Okay? Meaning careful with only hemothorax and the previous one too, meaning that we'll go back again. Careful with those two because you will have or a question from this one or a question from this one. That's it, the variance in the test. Now we are reaching pneumonia. As you see over here, I am basically reached chapter 23, and since you are checking the PowerPoint that I provided to you, those chapters are humongous. I am going directly what you need to know to answer that test correctly. Meaning that with the pass of time, when we are reaching the final, I will do some modification because I don't like to ask you the same thing, but I will probably provide more info for the final chapter to make the final test, even that some of the questions that you see in this one can show up again in the final. Now, pneumonia, important question for us because it's an inflammatory reaction in the alveoli and the interstitium caused by an infectious agent. What are the causes for this? Oropharyngeal secretions, composed of normal bacteria, flora, or gastric content, inhalations of contaminants, contamination from the systemic circulation. That's why I need to ask you that. Now, there is a classification that you will see more frequency in the hospital, and probably when you move to the core now, community acquired, hospital acquired, bacterial, active, and viral. I don't need to tell you a pneumonia that is acquired in the hospital is not the same one that the community acquired, because in the hospital one, you have a lot of bacteria that are resistant to medication, and probably that infection for pneumonia in the hospital could be a little bit more difficult to treat. Now, high risk, and this is associated with a question in the test because you have it over there, elderly, those with diminished gag reflex, meaning that they cannot swallow, seriously ill, hospitalized patient, hypoxic patient, and an immunocompromised patient. Meaning careful with this one because I have a question regarding the elderly and pneumonia. The pneumonia, exactly what I mentioned, we have some types: anaerobic bacteria present as lung abscess, necrotizing pneumonia or empyema, usually caused by aspirations of the normal oral bacteria into the lungs, and mycoplasma pneumonia, commonly seen in the summer and in the fall in young adults, common between the age of 5 and 20. Careful with these ones. Then the next one is pulmonary tuberculosis, and you already know that this is important because this particular fellow is becoming a little bit resistant with all the new drugs we have to fight him. And all these cases, me as a physician, I need to report these to the local and state health department. And there is an interesting curiosity that I will include over here. If we detect that you are positive to TB, you need to follow the treatment. If you don't follow the treatment, I can put you in jail. That is the most interesting about this, meaning that they will make the surveillance that you comply with the treatment. If you don't comply with the treatment, you basically could be arrested until you comply with the treatment for almost 3 to 6 months. That's a very interesting thing. The causes for this fellow, Mycobacterium tuberculosis, an acid fast aerobic bacillus, infected lung and lymph nodes, and the infection, inhalation of small droplets containing bacteria, droplet expelled with cough, sneeze, or talking. That is basically what spread this particular infection. Not all the people will become automatically infected and will present the disease, but some people that are immunocompromised, that are exposed, probably are the ones that will be more affected and quickly. Careful with this one too, because there is a questions about tuberculosis in the test. The classification, you have it over there. Usually clinically and radiographically, we need to do the famous X-ray, may lie dormant for years or decades, and he can reactivate again and can occur many years after the primary infection. Remember, impaired immune system causes the reactivation. Person with HIV, corticosteroid use, silicosis, and diabetes have been found to be associated with the reactivation of this particular infection. At this moment, I cover onto the chapter 23. I will do a tiny pause over there to then to go to the final two chapters, 24 and 25, that there is not a lot that I am putting out from those particular chapters, just to let you know what you need to know. Okay, as this is a more chapter, I will stop over here the recording